Hospitals, Hyderabad, a name synonymous with medical excellence, innovation, and compassion, it is my profound honor to welcome each and every one of you during this extraordinary moment. Today, our halls are graced not only by brilliance in healthcare, but by beauty with purpose. We are truly privileged to host the Miss World 2025 contestants here in the heart of Telangana, a state that celebrates culture, compassion, and care in equal measure. These young women embody the essence of beauty with a purpose, a philosophy that transcends mere appearance and delves into the heart of compassion, intelligence, and social responsibility. They are not just contestants, they are ambassadors of change, advocates of sustainability, and champions of cultural diversity. This is no ordinary visit. This is a confluence of purpose where the elegance and empathy of the Miss World platform meets the dedication and dynamism of India's leading healthcare institution. Joining us today are esteemed dignitaries, members of the Government of Telangana, representatives from the media, and our very own AIG family. A heartfelt welcome to you all. Now it is with my great privilege to invite our visionary leader, a globally acclaimed medical personality, a pioneer in gastroenterology across the globe, and the heart and soul behind AIG Hospitals, Dr. D. Nageshwar Reddy sir, our chairman, to felicitate the Miss World contestants. One by one, we now invite our elegant guests, the Miss World contestants, to please join us on stage for this special moment of welcome and recognition. Your presence today symbolizes the power of empathy and the global mission of spreading hope and healing. We will also be presenting our contestants with the Bathukama, which represents the cultural diversity of Telangana. Additionally, we will present a painting done by the famous artist Vaikuntham Garu, whose art is renowned. Tota Vaikuntham Garu is a renowned Indian painter born in Baragupalli, Telangana. His artwork is characterized by vibrant depictions of rural Telangana life, particularly focusing on women adorned in traditional attire. Along with this, they will receive a silver medal of AIG Hospitals. May I now request Ms. Nuria Patricia de Assis Ferreira from Angola onto the stage, please. Karen Jansen from Belgium. Cameroon. Funige Fatoumata Coulibaly from Cote d'Ivoire. Estela del Carmen Nguema Mangwe from Equatorial Guinea. Hasset Dereje Admasu from Ethiopia. Agatha Lukoet, France. from Guatemala. Kadiato-san from Guinea. Zalika Mandisa Samuels from Guyana. Grace Nima from Kenya. Nadakusa from Lebanon. Syria Olivine Tamanyombe from Madagascar. Sarupdeep Kaur from Malaysia. Martin Kutajar from Malta. Vena Alicia Rumna from Mauritius. Selma Carlisia Kamanya from Namibia. Joy Mogisola Raimi from Nigeria. Hannah Jennifer Johns from Northern Ireland. Maya Edithia Klaida from Poland. Valeria Nicole Perez Santiago from Puerto Rico. Mafama Regai from Senegal. Lasheve Alberta Kaiserine Davies from Sierra Leone. Zainab Abdikhani Jama from Somalia. Olive Jansen van Rensburg from South Africa. Dr. Idil Bilgin from Turkey. Courtney Tariwanshe Jongwe from Zimbabwe. Thank you, sir. That was indeed a heartfelt gesture and a powerful message that care knows no boundaries. Now, may I request Dr. Christina onto the stage, please. A distinguished bureaucrat, a dynamic leader, championing healthcare for the people of Telangana. Sir, may I please request to be on the stage to felicitate Miss Dr. Christina. Yes. She will now speak to us on the state's transformative work in public health, cancer care and women-centric healthcare initiatives.
Good morning, everyone. It's genuinely a pleasure to be here today at AIG Hospitals, interacting with such well-accomplished young delegates from the Miss World pageant. And I hear you're from over 440 countries, and we have with us doctors, medical professionals, nursing professionals, and it's really nice to come and interact with you today. You've all come from very far off places, representing your countries, your culture, your talents, and your vision. But more significantly, as beauties with a purpose, I'm so encouraged to see many of you prioritizing health as an area where you could make an impact. It's very important nowadays for you to have a clear mission, a clear vision, and to take up advocacy on areas which could impact society at large. Today we have also invited to join us around 100 government women healthcare professionals, and a lot of them are gynecologists and obstetricians, and they work with commitment to deliver quality, timely and free of cost healthcare to women from urban and rural villages across Telangana. So we thought it would be an apt forum for you to meet each other, and maybe after this interaction you could meet some of our dedicated women health force. Nobody can uplift women like women can. There is something unique in the way women bond with each other. We learn from shared experiences, and we learn from each other through mentorship and support. And quite often, women, as caregivers of families and communities, must prioritize our own health, not just for ourselves, but for the well-being of those who depend on us. Around the world, women don many roles, whether as mothers, daughters, healthcare workers, professionals, or leaders. Therefore, it is very critical to understand that women's health is not secondary, but foundational. When women prioritize our physical and mental well-being, we reinforce ourselves at our homes, workplaces, and society. Empowering women to take charge of our own health benefits entire communities. It means fewer preventable illnesses, it means stronger families, and it also means more resilient societies. Barriers to health, such as accessibility, affordability, equity, and even the liberty of choice, whatever limits our health, these are areas where we should collectively work. And in the Telangana government, we would like to urge not just our own government healthcare professionals, but we'd like to use these global platforms like Miss World and the vision and advocacy of each of the contestants here to work towards these goals. It means safe maternal care, it means reproductive health, it means education, protection against preventable diseases, and understanding that the global disease burden from non-communicable diseases like cancers, cancers of the breast, cancers of the cervix, are going to be our new challenges a decade from now. So today I'd like to take this opportunity to share some of the women health initiatives of the government of Telangana that we are working on, that we hope will help us achieve a better, inclusive health profile for the women of our state. So where's the... our presentation? So here we'll just make it a very brief presentation. Now in Telangana, advancing women's health in Telangana, we have got certain customized programs that we take up for women's health. And one of them is Arogya Mahila. It's an initiative of the government of Telangana towards inclusive and equitable healthcare. Women contribute around 49.7% of Telangana's population. And as we can see, there's a high burden of NCDs, especially among the middle-aged and older women. 55% of our women are in the age group of 16 to 49 years. Reproductive and hormonal issues are often underreported. As per the National Family Health Survey, some key statistics that we can see, we have got problems of anemia, we have got diabetes. Most of our women also have got problems of hypertension, and we can see that there's a very small percentage of women that actually take time to focus on their health, and women who have undergone cervical cancer test as a result of health screening is just 3.3%. Oral cancer testing, 2.5%, and breast cancer testing was even lower at around 0.3%. Now these are the issues that have triggered us to take a deeper look as to what we can do as government and how we can improve these health initiatives. So Arogya Mahila was launched in 2023. Arogya in Hindi means health, in Telugu means health, and Mahila means a woman. So we're talking about healthy women. And this is a trusted care offered by women for women. It is an exclusive women's only clinic, and it focuses on early detection and preventive screening. There's a seamless flow of care as we see it. Now all the women of the state are covered, and this is there at 372 primary healthcare facilities across our state. And in this, it is tied up with 37 designated tertiary healthcare facilities. So our goal is that we reach out to all the women in our state, and we encourage them to come to these free clinics on every Tuesday, where they will interact with a woman professional, a healthcare professional, who will assess their health and help them if they are requiring further screening or referrals at one of our secondary or tertiary healthcare facilities. Now, as we can see, we focus on 8 core areas when we deal with women who come to the Arogya Mahila clinics. Cancer screening, in which we focus on both breast, oral, and cervical cancers. We take up diagnostic tests free of cost. We address micronutrient deficiencies. UTIs and pelvic inflammatory diseases are quite common. Menopausal management. Then we go and look into their complaints that might be indicative of polycystic ovarian disease, family planning, menstrual issues and infertility management, then STDs and weight management. Now, when we link our screenings to specialty care, we have seen so far that 19.5 lakh women have been screened so far through our Arogya Mahila clinics. And this is done at these clinics by our medical officers who are women. And this leads to either medication and lifestyle training counseling or referrals where they can go in for further investigations. Now, out of this 19 lakh women who have been screened, 3 lakh women have undergone investigations, and around 42,638 of them were referred to higher centers. And these normally are turning out to be cases where we have been able to help diagnose early stages of cancer. Now, when we look at the cancer care profile, oral cancer, cervical cancer, and breast cancer, these are the cases which have been examined from the footfalls that we get in our AIG clinics. Around 14.86 lakh women were examined for oral cancer, 3.51 lakh women were examined for cervical cancer, and 14.49 lakh women were examined for breast cancers. And naturally, as we have planned in a referral mechanism, suspected patients or patients who have been found to have signs that are indicative of any of these non-communicable diseases have been referred to higher centers for treatment. I'd just like to underline here that to make healthcare more accessible, it is absolutely essential to make it local, to make it free of cost, and to make it something that is approachable for them. So it is very important that we have these which are free of cost, and that we ensure that there are women doctors, women nurses, and women staff, and the patients themselves are women, so they can be free, they can talk about their problems, and then they can feel free to come back, because as we all know, the comfort factor is much higher when they deal with women healthcare givers. Now, when we look at endocrinal and hormonal health, we have seen almost 5.6 lakh women. Thyroid disorders, 19.2 lakh women have been examined. And for PCOD, menstrual issues, around 2.7 lakh women are examined. And even for menopausal issues, 3.7 lakh women have been screened so far. The interventions that we afford are nutritional counseling, free medication, and lifestyle training programs, apart from referrals to the higher facilities, which are there in our government setup. We have got a robust infrastructure to support this kind of an initiative. We have got higher referral centers where we have the MNJ Cancer Hospital at Hyderabad, which is our regional cancer center in India. We have the Nizam's Institute of Medical Sciences, which offers advanced care. And we have our teaching hospitals. Recently, as a sustained initiative from the government of Telangana, we now have one medical college and one government teaching hospital in each of the districts of Telangana. So that has brought specialized services down to the level of the districts. And of course, we have these women-centric clinics, 372 of them, and we have the free ambulance services which can specifically transport them from the primary to secondary or tertiary referral facilities. So now the blueprint for our action is to scale up Arogya Mahila screening, because we feel this is something that is very much doable, and the footfalls have been very encouraging. The clinic expansion, we would like to increase it to cover all primary healthcare facilities by 2026. We would like to train our ASHA workers, who are an incredible presence in the villages, and they are very critical, and they make the critical difference between mobilizing women for screenings and ensuring that they have adequate follow-up. It is quite interesting to note that even after women have been screened and diagnosed, the follow-up treatment is often something that's a problem. We see it tapers down to almost 70% of cases where they often neglect follow-ups. And that is why the role of the ASHA workers, who are our grassroots level functionaries, are very important, because they need to mobilize women to have effective follow-ups. Awareness and prevention, data integration through a centralized cancer registry, and centers of excellence. Now, right now, we are in the process of setting up 10 regional cancer care centers in our state. And we hope all of this will augment and make the healthcare system a more equitable and more inclusive kind of a process that's available free of cost for the women in our state. The health infrastructure in Telangana is good. As you might have seen today, you have visited Dr. Nageshwar Reddy's hospital. You have seen that advanced healthcare is available. And we have 7 such JCI accredited hospitals. We also have 76 national accredited hospitals, and this is in the private sector, apart from which we have 49 government tertiary care hospitals and over 6,700 government healthcare facilities. Now this entire bandwidth, both a combination of private healthcare and government healthcare, is all meant to build and to deliver quality healthcare through a wide and well-connected network of facilities. We have got highly skilled doctors, and you have met many of them today, I'm sure. We have state-of-the-art facilities. We have accredited hospitals that offer international standards, and it's very cost-effective to have treatments done here in Telangana. The average cost of quality health care in Telangana, as compared to the costs in the US or the EU, is almost 50% to 70% lower. So in this environment that we have of quality health care, of great, highly skilled, trained doctors, and affordable health care, we feel that Telangana is poised to play a very significant role in attracting medical value tourists to our state. These are some of the JCI accredited hospitals in Telangana, and due to paucity of time, I think today your sessions have been scheduled with AIG Hospital. And apart from this, we have also got health infrastructure